Good morning, Hank. It's Tuesday. So later this month, we'll be making a big announcement about working with Partners in Health Sierra Leone. But before that, I thought it might be helpful to consider why Sierra Leone is so poor. Now, poverty is complex, and we are not going to get to the bottom of it in a YouTube video, but I do think this can be some helpful context. Okay, so Sierra Leone, located here, is a nation of around 7.5 million people. It's ethnically and religiously diverse. Most Sierra Leoneans are descendants of people who've long lived in West Africa, but many former slaves in the British Empire were resettled here, and so there are Sierra Leoneans who trace their descent to Canada or to England, to Nigeria, and many other places. And while I was in Sierra Leone earlier this year, someone told me that to understand its impoverishment, I should look at a map showing all the railroad tracks that were built in Sierra Leone while it was a British colony. As you can see, the train tracks didn't really connect cities to each other. They connected the mineral-rich areas of Sierra Leone to the coast of Sierra Leone so those minerals could be exported. And this is a very important thing to understand about colonization. It was in the business of resource extraction, and so the systems that were built in colonies were resource extraction systems. There was not much colonial investment in, say, health systems or education systems, and since Sierra Leone achieved independence in 1961, it has struggled to transition away from resource extraction and to build the kinds of systems, infrastructure, healthcare, even mail delivery, that would lead to a more balanced economy and a healthier population. Now, it's easy to blame these failures on a single cause, like, say, corruption, but while corruption is a serious problem in poor countries around the world, the bigger problem by far is that it's very hard to build health and education and infrastructure systems in communities that have been built around resource extraction. That's true all over the world. But also, a community just cannot spend what it does not have. Like, if Sierra Leone spent the same percentage of its economy on healthcare and education as, say, the United Kingdom does, Sierra Leone would have about $45 per person per year to spend on healthcare and a similar amount per child per year to spend on education. That's just obviously inadequate. Like, in the US, we spend over $10,000 per person per year on healthcare and over $12,000 per child per year on education. Okay, so all these challenges were compounded in Sierra Leone by a long and extremely violent civil war, which lasted from 1991 to 2002. Tens of thousands of people died, millions were displaced, the healthcare system was devastated, HIV infections increased, deaths from every cause increased, and education and professional development were interrupted as schools closed or students had to flee violence. Like Dr. Byler Barry, who founded the widely respected Wellbody Clinic in Sierra Leone, had to leave his studies for a time to escape to a refugee camp, and I heard similar stories from several healthcare workers. Because the Civil War was on all sides partly funded by trade in diamonds and other valuable minerals, the war was especially devastating to Sierra Leone's diamond mining district, Kono. And as we traveled through Kono, I kept thinking about that old Faulkner line about how the past is never dead. It's not even past. In the end, the government paid for a mercenary army and weaponry in part by selling the rights to the country's largest diamond concession. And so today, almost none of the wealth generated by Kono's diamond mines ends up in Kono. And this has led to a paradox that is common in poor countries. While Kono is one of the richest parts of West Africa by some measures in terms of poverty rates, malnutrition, disease burden, and child and maternal mortality, it is one of the poorest and least healthy places in the world. Because while diamond mining produces a lot of money, there aren't actually that many jobs for Sierra Leoneans in the mines. Meanwhile, all around the mine, just outside the fence, you will see many people working at breaking stone to eventually be sold as gravel. This is how you end up with a country where $100 million in diamonds gets exported annually, and 6%